session. We're so happy that you can join us this morning. My name is Lisa Bailey, and I am the communications consultant with the Sub-Regional Office of the Pan American Health Organization. And this training this morning is on covering domestic violence and the COVID-19 pandemic. We want to thank the Caribbean Development Bank, the Caribbean Broadcasting Union, and we have a new partner for this session. This is our third session with Internews. Now, we're going to be talking with our panelists today. Is really all about hearing from you, getting some information, but then having a discussion about covering this very important and difficult topic. So we're talking about domestic violence, and it is basically a pattern of coercive tactics, including emotional, physical, sexual, and or economic abuse that adults and adolescents use against their intimate partners to gain or maintain power or control over them. So generally, studies have found that reports of domestic violence fatalities did not accurately cover incidents because of maybe a failure to identify the act as a domestic violence crime or place the murder in the larger context of domestic violence. Sometimes we realize that we don't always utilize experts as sources for stories as well. And a lot of times coverage of domestic violence may reinforce myths and inaccuracies about domestic violence. So today we want to talk about covering this very difficult topic, and now with an added difficulty of COVID-19. So we're going to start with an interactive poll, but then after that you will be hearing from, we'll frame the discussion, and that will be done by Britta Bear. She's an advisor for violence prevention for the Pan American Health Organization based in Washington. And we have 4 panelists for you. Arwen Kidd, she's a pandemic media mentor with Internews Canada. She'll tell you all about Internews when she gets to talk with you. Isabella Ponce, Chief Editorial Officer in Ecuador, GK in Ecuador. Nacasia Logan, journalist with the National Communications Network in Guyana, and Anesta Henry, and she's a reporter with Barbados Today in Barbados. We also have online 2 gender specialists from the Caribbean Development Bank, our partner in Formala Jacobs and Jessica Harris. So we have a lot to discuss. So we're not going to spend a lot of time on my introductions. We're going to go straight. I'm going to hand now to the person who's pulled this all together for us in Dr. Elisa Prieto, and she is going to be leading us off with the questions that we have for you. Dr. Prieto is responsible for NCDs and mental health, and she has been a big force in making sure that these trainings happen. So I'm going to hand over to Elisa. She'll tell you about the poll, and then we'll get going from there. Elisa, over to you.
Thanks so much, Lisa, for those kind words, and welcome everybody. It's great to have such a nice list of attendees, and we want to start by hearing a little bit from you. We want this session to be as interactive as possible. We've lined up a panel that really intends to open a conversation, and we really want to hear from you. So we want to start with a poll. I think we're all getting used to Zoom virtual sessions, so we are learning a little bit about these features. What I'm going to do now is launch the poll, and you will get the questions on your screen, and we would like you to answer them. They are anonymous, and they will really help us learn a little bit about how you feel on this topic, what you know, what you think, and it will be very helpful as we go into the panel. So I am launching the poll. Which you should be getting in the screen. And I will give you a few minutes to go through the questions and give us your answers. So feel free to just go and answer at your own pace.
As we wait, I see there was a comment that my audio wasn't great. I just want to see if this is better. I've removed the headphones. Is this better?
I can hear you well. Yeah.
Yes?
Mm-hmm.
Okay, good.
So maybe I can read through the questions. The first question is, how important is reporting on violence in the context of COVID-19 to you and your job? So if you want to just go and give us your thoughts, your feelings about reporting on violence in the context of COVID-19. The answers are going to be completely anonymous, and it's just a way of starting the conversation and hearing from you how you feel about this topic. And So I can see more people are answering. That's great.
Elisa, I see a couple people saying they're unable to see the poll, so I don't think you were supposed to do anything. It should just pop up.
It should
so
pop
just let
up
us know if you can still see it.
It should pop up in your screen. And it's a total of 5 questions.
And are you getting responses still, Elisa?
I'm getting 10.
Okay.
So I think people are starting to figure it out. It should pop up in your screen. And it's 5 questions. I feel it's probably easier for colleagues to just read through them at their own pace. We're just going to give a little more time so you get a chance to read through them and get back to us with your responses. And while colleagues respond, we really want to encourage you to participate. So for those of you who are familiar with Zoom, you know you can either use the chat function to share your thoughts, but there's also the question and answer feature where you can, as we go into the presentations on the panel, just make questions that you can address if you want to a specific panelist. And we will be trying to cover as much as we can. So you can use one of those 2 features. We would also love to hear your voices. So if you want to, you know, take the mic and make a comment or share an experience or, you know, ask a question, we would love that. So just raise your hand, and again, we will try to accommodate as many interventions as possible. We really want this to be a conversation, and that's why we thought it would be good to start with hearing from you. And I think your responses to this little questionnaire are going to be very helpful to our colleagues as we go into the panel. Okay, so now we have 22 colleagues who have responded. I'm going to give just a couple more minutes, and then we will launch the results so you can see how the room is feeling about this topic. All right, so I'll close the polling. And you should be seeing the results now. Thanks so much for responding. A majority of colleagues that are connected actually responded, which is great. The first question was, how important is reporting on violence in the context of COVID-19 to you and your job? And as you can see, for a majority of you, this is very important or somewhat important. That's great. How do you feel about reporting on domestic violence in the context of COVID-19? And this is also great to see that quite a few of you feel enthusiastic and empowered. But we also have quite a few of responses saying helpless, confused, indifferent, and we hope we can address some of this during the session today. The next question was, when reporting on domestic violence, it is important that and here we have a majority of colleagues saying, include information about helplines and response services. And I think this is great. And we will be touching on this idea of solutions journalism and how journalists can really lend their voices to help. When reporting on domestic violence, it is not important that I And a majority of you have said add a photo or image of the victim and survivor. And again, we will be touching on some of the recommendations about reporting on this very sensitive topic. So we'll come back to this during the presentations and panel. And the last one is, what is your main challenge for reporting on domestic violence right now? And here, I think you have, in a way, touched on all the different things that we felt could be challenges. So there is no data, I don't feel technically equipped, sorry, the topic is too sensitive, taboo, I don't know how to deal with survivors. So again, we hope that the session today will help us at least touch on some of these challenges and give you some tools to be able to feel better prepared. So one additional question we had is there any burning topic or issue that you would like us to address? So please feel free to use the chat to let us know about anything in particular that you would like us to address during the panel discussion. And we'll be happy to accommodate that. So I'll stop here and I'll hand over to you, Lisa.
Thank you very much, Elisa. Those were very interesting results. I didn't expect some of those answers, so that's interesting, and I hope that we can make this a conversation for sure. So before we go any further with the panel, we're going to frame the discussion, and we're going to ask Britta Bear. She's an advisor, and she focuses on violence prevention with the Pan American Health Organization to focus on domestic violence during the COVID-19 pandemic and give us some tips and maybe frame the topic for us. So over to you, Britta.
Okay, good morning, everybody. And I have no idea what my slide is doing this. Sorry, give me a second. Okay, good morning, everybody, and thank you so much for everybody for participating. I know these are really busy times, and I appreciate the interest in the topic. In my work, it is very hard to be effective without the collaboration with journalists, with communicators on this topic. So I'm really, really pleased at the interest and your commitment to the issue. My job today is to just introduce the issue and introduce or hint at some of the things that will come up in the panel and get you thinking about some of the questions that you might have. As Elisa and Lisa mentioned at the beginning, we really want this to be practical. So I would strongly encourage you to add questions to the chat, to take the floor later, and to share your experiences and your concerns and your good practices to make this as practical as possible. So we know that COVID-19 has led to a lot of changes in many different ways. And one of the things that we've seen that since the start of the pandemic has been an increase in visibility and an increase in interest by communicators, by journalists, and by many others in the topic of domestic violence in the context of COVID-19. And these are just some examples of headlines I have recently found by a quick Google search. But we also know that violence in general is not a new topic. It's not a new challenge for this region. And we also know that violence, which is defined as the intentional use of force, physical force, actual or threatened or power, against and between persons, that results in harm, in injury, in ill health, in neglect, in deprivation, takes many, many different forms. We will be talking today more specifically about domestic violence, violence in the home, but I do want to start stressing that violence in all its forms, and there are many forms that we see in the region, is not justified. All have serious consequences and benefit from the involvement of journalists. But today, in the context of COVID-19, we'll be focusing a lot on domestic violence. And just to give one example of one form of domestic violence, intimate partner violence, we know that this is an ongoing challenge in the region. We know, for example, that about 1 in 3 women experience in their lifetime physical and or sexual violence by an intimate partner. And that holds across different countries and in the region as a whole. So we already have a large group of people that are affected by violence before the pandemic has even started. We also know that in the context of COVID-19 measures, the risk of domestic violence might be increasing. We are living in a situation where there's more stress, more anxiety, potentially greater abuse of alcohol, drugs, a greater burden of domestic tasks on women in families, school closures, high risks of losing jobs, or other economic or social worries. All of this are potential risk factors that can increase the chance of violence happening. At the same time, we know that protective factors for violence are reducing, such as there will be, for many of us, less contact with family and friends, less social or informal support, less access to needed services, including health services and protection services for survivors, and closure of many of our usual activities that would help us identify those most at risk. So while risk factors of violence increase, for domestic violence, protective factors decrease as people are now spending more time in their home. And for many, that home is not a safe place. This is why we are particularly concerned with the topic of domestic violence, violence in the home right now. And while we don't have new or updated prevalence data in the context of an emergency such as this one, we do have, or we can often in many countries or settings look at administrative data that give us an idea of service use, for example, increases in help seeking, increases in calls to helplines, increases in reports to the police that suggest a potential increase in risk or a potential increase in demand for support. And that makes us very worried. At the same time, we also see in other locations and other countries sometimes pauses in these kind of help seeking. Pauses in the number of calls, or reductions in the number of calls, or reductions in the number of service users. And that makes us equally worried. It doesn't mean that violence reduces. It means that there will likely be more disruptions in the number of support services or new access barrier for survivors in needed support. So while we don't have prevalence data, we can draw on prevalence data before the pandemic that give us an idea of context. We can use administrative data, data on helplines or services to give us an idea of the scale of the challenge. And I just want to stress that while we look at domestic violence, which is violence in the home, given that more and more people now in the context of COVID-19 are being asked to stay home, who do we care about? We know from the data that women, children, and older persons are particularly vulnerable to violence in the home. And the different types of violence that are, like violence in the home being an umbrella term, are included, are quite diverse, and each group will have slightly specific needs. But it includes, for example, physical, sexual, and emotional violence by an intimate partner, which could be a husband, a boyfriend, another type of partner, or against a woman, which is the most common form of violence against women that we see in the region, and a particular concern right now. But it also includes different types of child maltreatment or elder abuse in the family. And I just want to quickly, sometimes when we report on violence, we report on it because of a specific event, a specific violent event. Often it might be a death that's particularly shocking, or there might be an interest to do a femicide. But we need to keep in mind when we report on violence that the femicide is sort of the tip of the iceberg. The death is the tip of the iceberg. What it's hiding is the context of the issue. We know that violence is never an isolated incident. It might seem that way at first glance, but there is a responsibility for all of us to look beneath the surface and look at the context. We know that violence, that abusive relationships, for example, between a man and woman, they very, very rarely start with death. They are normally a series of violence acts that escalate. So there is a role for all of us to look at the broader context and not portray violence as an isolated act, even if that is our hook. part of, I think, understanding context of violence is also to be aware of its hidden nature, particularly when it comes to domestic violence. It is violence that happens in the home. So often it is less visible. In the context of COVID-19, where we have less direct contact, for example, due to school closures or due to remote working or due to disruptions in services, and closures of businesses and shops, and all of the different ways that COVID-19 has affected our lives, it also means that violence is even more invisible. It makes it even harder to identify survivors, to reach survivors and understand about the topic. But there is, I think, a real responsibility for all of us, including communicators and journalists, to give visibility to the issue, to talk about it. But at the same time, I think the flip side of this is also to recognize that there's a lot of stigma that comes with the topic of violence. There's a lot of sensitivity that comes with the topic of violence. I think about 20% in the survey responded that, that the topic was seen as too sensitive. It is something I often hear. And part of that also means that we need to be aware of the potential risk of stigma and the potential risk of discrimination when we talk or reach out to survivors. So that means that on the one hand, we have a responsibility to frame it in sort of a human rights framework and a gender equality framework, to frame the issue, frame survivors, and I use the word survivors specifically instead of victims, as resilient, as empowered, and to tell their backstory as well. And I think that comes to the issue that violence at its heart, at its core, is about power inequalities. We know, for example, violence against women is rooted in gender inequalities and other social inequalities. And this is core to understanding the issue. And part of that means that we need to be careful with our language and how we frame the issue, to avoid stereotypes, to avoid diagnosing the problem and making it a specific behavior or issue, or putting blame or judgment on the survivor. And it means that we need to be careful about our tone in how we speak about violence in general, including about avoiding sensational or language, or trying not to trivialize the problem. We need to be careful on how we balance information, on how we use quotes, how we so it is these little things, how we use euphemisms, or rather to avoid euphemism at all times, and to use definitions, to use technical language as much as we can, and data to frame the issue, to give the context, but also be very careful about not misrepresenting things in generalizations, in trying to diagnose or give cause to a certain behavior that we might not know, that we might not sure about. And I think we will raise some of these issues and the do's and don'ts in different in the panel, and I would encourage you to think about this in your own work and to raise questions or examples, because it's often in the details that I find where it becomes challenging, where we run into some of these difficulties. And we'd love to hear from you and how you have addressed some of these issues. And then lastly, I think, and this is going to be my final point, I think the power of journalism, of communication, is immense. Communicators and journalists are in a unique position to make a difference, including in how they reach out and communicate to communities and survivors in what they do. And they're in an incredibly powerful position to share some key messages, key solutions with survivors and their communities. And this is an example of messages by PAHO for survivors. It makes a huge difference in the life of the survivor, in the life of communities, when journalists, communicators, when newspapers, when TV ads talk about violence not being the fault of the survivor, making very clear in the writing that violence is never acceptable, it's never justified, and that there is help, and to encourage survivors to seek help by, for example, providing information on helplines or services that might be available in the area. This is an incredibly important contribution to the agenda, and I think that is why it is so very valuable to work with journalists, work with all of you, to engage you in this topic, because one of the challenges with violence is that there is no single solution, but there's a role for all of us to help advance the agenda and find many different solutions for survivors and the community. I will end here, but very much looking forward to your thoughts and the forthcoming panel. Thanks very much.
Thank you, Britta. I'm going to veer off of what we said we would do, and I'm going to give you this question early because I think it will maybe get the conversation going in people's minds before we go to the panel. There's a question about using male peer-to-peer programs to reduce domestic violence. Is there an example like this that reporters can use?
Yeah, so yes, definitely. I mean, there are good examples engaging men, encouraging men, maybe talking about domestic violence against women, intimate partner violence against women. There is a strong need, and that's very much supported by the evidence, that we need to engage not just women, but we need to engage with society as a whole, including as an important role for men and boys to help prevent violence. And a part of that is there are examples of programs in the region that involve many different ones to engage men in different ways to fight against violence against women and to fight against some of the gender and social norms that are associated with violent behaviors. For example, the issue of masculinities and different programs that talk about manhood and what it means. So definitely, this is a good example of an evidence-based prevention strategy that could be highlighted as a good example, a good practice in an article. And I think it's an example that that shows that within an article, we don't not necessarily have to talk about the potential death or the violent incident and the context of that, but we can also point to solutions and examples of solutions in different countries, including our own. And because we do really want to stress that it is possible to prevent violence. It is not inevitable. It is possible. And in fact, in many different Caribbean countries, there are many different efforts, including different programs engaging men that aim to do that and have shown to be effective.
Well, thank you very much, Britta. We are going to go now to our panel discussion. I have 2 more questions, but we're going to hold those until after. They were even sent before we started this discussion, but we're going to hold those until after. And remember, you can drop your questions in the Q&A or just in the chat. We'll be monitoring that as well. So I'm going to introduce our panelists now. They are 4 ladies. Lots of ladies, they're here today. We're going to start with Arwen Kidd. She's a pandemic media mentor with Internews, and she'll tell you all about Internews based in Canada. We have Isabella Ponce, Chief Editorial Officer for GK in Ecuador. Nacasia Logan, close by in Guyana. She's with the National Communications Network. And Anesta Henry, even closer to me, because she's here in Barbados. She works with Barbados Today, and she's a reporter. And we also have standing by our partners at the Caribbean Development Bank, gender specialist Parmala Jacobs and Jessica Harris. So we're going to start the discussion now. I'm going to just let everyone turn on their cameras, and I'm going to let everyone start by maybe introducing themselves, just saying a little bit about yourself and what you hope we can get out of the discussion today. So I'll start with, as the list went, with Arwen Kidd. Maybe just turn on, say hello, and tell us a little bit about yourself.
Hi, Lisa. Hi, everyone. My name is Arwen Kidd. As Lisa said, I'm currently in Canada, but I'm actually normally based in West Africa, in Sierra Leone and Liberia, where a lot of my work concentrates. So as she said, I'm a pandemic media mentor for Internews. Internews is an international nonprofit organization. We work in more than 100 countries around the world, and we specifically focus on working with citizens and local media in order to ensure that people have access to information they need to make decisions that affect their lives. to participate in their communities, in their countries, and to hold power to account. So me personally, I've been working for more than 12 years now, producing as well as training media. And my background is largely in visual storytelling. So I do print, but I also do photography and video and documentary. And a lot of my experience to do with reporting on gender-based violence or sexual and gender-based violence has to do with working with organizations such as UNICEF. So working with them to tell stories about how women and girls are affected by gender-based violence, as well as issues in most of my work is in West Africa. So we also have issues there such as child marriage, female genital mutilation, and working to tell these stories in a way that protects the individuals, you know, ensures their dignity, but also explains the context and explains why these issues are important. So I'd love to get more into that today.
Great, thank you so much, Arwen. Let's go to Isabella now.
Hello, Lisa and everyone. Thank you for the invitation. My name is Isabella Ponce, and I'm a journalist. And as I said, I'm the co-founder and the chief editorial officer at GK. It's an independent media outlet in Ecuador. And one of its main focus is specifically gender. So in the last 5 years, my work has been focused on reporting gender-based violence, women, and specifically girls' rights. And some of the stories I've written, and at GK, we try to track the social impact of them. So this is why what Brita already said, I think it's so important that we really realize how journalists can help to raise awareness about these topics. So last year, for instance, I published an investigative piece on a gymnastics teacher that abused his students that were underage girls. And after we published it, the gym was closed and the prosecutor's office opened an investigation. So we're all the time trying to raise awareness about the topics, but also, as Brita said, I really like everything she said. Like I could say the same over and over again. The advices that you can give to women through journalism, you know, like how can you help them to be more empowered. So I've chose to report on this topic in the last year because I really think it's very important to contribute somehow to a less unequal society. So yeah, I'm very excited to talk with all of you about it. I know like the other panelists are they have a lot of experience on the topic, and I'm really here trying to answer the questions that the other journalists have, because I really think in the importance of creating and growing these networks of journalists that report on gender, because it's not, at least in Ecuador, it's not so popular. And we live in a country that every 3 days a woman is murdered for gender reasons. So yeah, thank you again for the invitation. I'm willing to have a conversation with all of you.
Okay. Thank you very much, Isabella. We're going to go to Nacasia now. Nacasia Logan in Guyana.
Hi guys, good morning. My name is Nacasia Logan. I'm a journalist attached to the National Communications Network. It's the state agency here in Guyana. My background, I've been with the media for 12 years, and I've mostly covered security, social issue, and security. Domestic violence falls under that because oftentimes I have to do stories pertaining to domestic murders. And so I am hoping that, you know, more women can come out, speak out, feel empowered, you know. And so our message today, I pray that it gets to more and more women, because a lot of them do not want to speak out. They have this story, as Britta said, when there is a death or when there's a murder stemming from domestic violence, there is more to it. So going in depth to find out, you know, where that stemmed from. I'm hoping that more persons speak out and that we can help them by doing more stories and letting them know that there are places out there that can help if they want help.
Thank you, Natasha. And we're going now to Anesta. Anesta Henry.
Hi, good morning, everyone. Anesta Henry from Barbados today. I usually, I like to say I report on cases of domestic violence, usually when someone is about to go into a box, when they have died. I believe that it's time for that to stop. And working in a society in Barbados where it's culturally speaking out about issues of domestic violence is considered taboo. It is kind of hard to tackle the topic as a journalist. It's not as easy as some may want to make it seem. So I'm hoping that this forum, while I'm open to the discussion, I'm really hoping that I walk away with the knowledge and the skills to better be able to approach the issue and to report on issues of domestic violence, not only when someone is going into a box, but as it relates to introducing preventative measures. Thank you.
Thank you, Vanessa. Don't turn off yet because we're going to start with you. And as everyone was talking, and Britta, that was such a really thought-provoking presentation. I love how you presented the topic. Anesta, I wanted to ask you, why do you think reporting on domestic violence is so important? And as everyone was talking, I was saying, you know what, I think part of it is that most of the times reporters are covering the incident and not the topic. So why do you think reporting on domestic violence is so important, Anesta?
First, we must acknowledge that domestic violence cases increase in times of pandemics as a result of other major issues, as Britta would have announced, such as high unemployment rates. Couples who cannot seem to get along are stuck in the same household for days because the country may be on lockdown mode, among other factors. So because we do not want domestic violence to be a hidden pandemic within a pandemic, then it is important that the media keep the public's attention on the fact that women and children become a lot more vulnerable in these types of environments where many women are not working and may be able to provide safe spaces for themselves and their offspring. So journalists basically highlight the issue and make people understand that the pandemic is not about loss of jobs and how to stay healthy. It is not just about that, but it is also about how we keep the vulnerable population, including domestic violence victims, or as Britta said, survivors, safe. Then let us not forget that there are people living in dysfunctional circumstances and may be enduring abuse, but they think it is normal. Therefore, it is the responsibility of the journalist to provide those statistics and those stories to help people understand what I am tolerating here is not normal. For example, a woman might not identify her boyfriend asking her for sex in return for money as problematic until a journalist does a story on the impact of women losing jobs in a pandemic that she may realize, this is exploitation. People act on what they know about and what they understand, especially if it is coming from a well-rounded and well-researched story, which is brought to light. So in light of all I have said, it is definitely important to build journalist capacity on the topic to help others understand. Journalists should align themselves with relevant state and non-governmental agencies to receive training on how to approach a topic in the correct way, particularly considering that it is not one of the easiest topics to approach, as I said before, in a world where, it's just taboo. The media is a fourth estate. It is about the society helping the society and keeping it functioning. I just want to say that in preparation for this this discussion, I would have had a conversation with the president of the National Organization of Women, Ms. Marsha Hines, who's very passionate about the issue. Right now in Barbados, where our singular economic driver, tourism, has been wiped out. Many women are jobless, many women are penniless. At this point, we have an issue here where only recently the National Organization of Women, the same president, Ms. Marsha Hingsley, she was saying that they have received an increase in reports from victims or survivors reporting that, they're, about domestic violence cases as a result of the pandemic. So yeah, these are just some of the reasons why it is important to report on issues of domestic violence.
Thank you, Vanessa. And I see Ms. Hines is online. I hope we'll hear your voice at some point, Marcia. I know you have very strong views on this issue, and I hope you are very glad that we're doing this session here today. Natasha, over to you now. Do you agree? Do you think it's very important for us to cover it and in the correct way? What is the correct way, do you think, right now?
Is there a correct way? Is there really a correct way in covering domestic violence cases? Yes, there is. It is a sensitive topic, and so we have to be very careful in how we report on these things. Especially as Anesta said, it has stigma attached to it, and so how we go about reporting on it is very important. Reporting on it, for me, it's it hits home for me because I am a woman, and more so, I do not like to see women be taken advantage of. I mean, it's not only women who suffer domestic violence, it's men. And as Britta say, I think she was talking about men and men forum. So I think it is very important to talk about it, but talk about it in a more sensitive manner. Some statistics here that we have, I've noticed. I spoke to our crime chief here this morning, Mr. Wendell Blanham, and what I've seen in the statistics is that we've had reduction in domestic reports and domestic murders. I know it's the COVID period and more persons are home, but I don't know if reports are not coming in, but it's good that I'm seeing that there is a reduction in domestic murders and domestic reports. But what I encourage persons to do if they are suffering from domestic abuse at home is to come forward, even if they have to reach out to those organizations that we have in the country. In Guyana, we have Help and Shelter, we have Red Thread, we have Builders United. We have many organizations here in Guyana, and so persons should not fear in reaching out, even if they want to reach out to journalists via text messages, because persons know somebody who they can reach out to, and then they can advise you, this person may help you. So as you were saying, reporting on it is very important, but how we report on it, it's also very important. We must be sensitive to the issue and be careful as well to protect the identity of that person. Over to you, Lisa.
Thank you. Thanks, Nkasia. No, I was just thinking as you were talking, and perhaps this is what's happening. We may see a reduction, but it may be because the person cannot report because they're in a difficult situation, right? So let's not celebrate any reductions yet. And there's already discussion in the chat about reporting and our statistics. Are we even reporting on this in the right way? I want to bring in Isabella here in terms of the context of reporting on this area. It is a human rights issue, and it's not a singular incident. From your framework and where you are, your context, how can you tell us about how to report on it, bearing in mind the wider context, Isabella?
Yes, taking the same example that Nakasia was using, I have some numbers of the first semester in 2020, 19, and 18, and you have like 21,000, 14,000, and now 8,000. So it decreased. But what I mean with context is not celebrating, but saying why it is decreasing. And Brita gave like all the reasons why. And so when you see like a number, you need to understand what is behind it. So that's the first part in gender violence. You mentioned it, and I see the key, it's like violence is never a singular incident, and also really show this iceberg, which I think is brilliant, because when you see a femicide, it has already, it's like all the time, like the biggest majority had already have physical violence or psychological violence. Or so for instance, this Monday, we published an article on a femicide in a border city in Ecuador. And we tell the story of that incident specifically, but we never, even if it might sound like we'll already have said that or written that before, we have to write how many femicides during the year. You know, like now we have 71 in 2020. So we write how many, where they have been, the children that are left orphans because of the femicides, and all the things that can explain what does it mean to kill a woman. And obviously in the last 6 months, we have include the COVID context, which is also very important. And I know I'm mentioning Brita a lot, but I think it was very, very key point what she mentioned about economical crisis and, you know, drinking and all these things that you need to include in the context, but it's very important also not to fall into stereotypes or explaining why he killed her, you know. So it's sometimes it can be like a challenge to give the precise amount of information without re-victimization, you know. For instance, if you will include how she was murdered, you know, but you have to always think in your intention about it. For instance, you should never include in the headlines the reason why, like I'm really doing like it would be a reason, and how she died, you know, because the focus will be like, oh, that's so awful, you know, he used whatever knife, or, and that will not make the focus be on the violence and the context and the social problem, but the issue itself of the knife or whatever, you know. So I think each case, it's different, and it should be treated like very with obviously a lot of responsibility, and trying to I would say like educate the audience on the topic. So each piece should have the context that I already mentioned, like the femicides. I know in Ecuador, it's in 2014, it was included in the laws, like specifically women being murdered for gender reasons. So the last thing I want to say, and I think is very important about the context, is like you always will have the official numbers, you know, like the attorney officer, you know, or formal complaints, but I'm always very close to NGOs and these shelters and such, because at least here in Ecuador, they have different numbers, and they obviously are higher because they are working very close to women that are not able even to receive help from the government. So it's really important to have both. You know, you can say like this year, I think till today, I said 71. That number is from these NGOs and civil society organizations, but I think the government counts like 30 something, you know, like half of it. So you need to understand the whole context and why the government is having half of them, because they need to wait 1 or 2 years for the investigation and to declare it a femicide. So as every other beat in journalism, it requires to understand, you know, the processes, the steps you need to follow to seek for help. And that's also things that it's important to include, maybe not in the written part, but as Arwen said, maybe some infographics or things that you can help as service. So like you can call this and that, you can go this and that. And at GK, we also do that. We publish like a phone book once in all the country where you can call to ask for help during the quarantine, which was like very harsh for many women. So just to sum up, you need to be very careful and responsible for each story you're writing.
Okay. Thank you, Isabella. Arvind, I'm going to bring you in here in terms of this whole human rights approach. And there are already questions coming in on it. I'm just going to weave them into our discussion. Bearing that in mind, the question from Beverly Sinclair is how do journalists report on the issue, going beyond the stats and getting to the people, bearing in mind this is a human rights issue?
Yeah, I think I think I want to also touch back on what Isabella said about being so careful with every story we cover, because as you said, it is a human rights issue. You know, women and everyone, I mean, women, girls, boys, men, we all have the right to security. We all have the right to feel safe, to have our liberty. And so it is certainly a human rights issue. And it took a long time to sort of make sure that gender-based violence and domestic violence was viewed as such. And it wasn't just viewed as a private issue at home, but it actually was a protection issue in which governments got involved, police got involved, and the legal system got involved. So it certainly is, you know, a human rights issue. And as journalists, we can do a lot by reminding our audiences of that. But with part of that comes the responsibility that, you know, Isabella mentioned it, we have to be so careful when we do cover these issues. And part of, you know, whenever we train journalists, we always focus on ethics, right? And one of the major ethics for journalism, regardless of the topic of your story or of your beat, is do no harm. And I think that especially when it comes to domestic violence and issues of protection, do no harm should be at the forefront with whatever, you know, whatever part of the story that we're working on. And part of that is in how we go about interviewing our subjects. So if they are, for example, survivors, making sure that the way that we interview them does not re-traumatize them, that we are very conscious about interviewing them in a way that allows them not to go into detail if they're not comfortable, right? Or if especially if it is a case of a minor that you are interviewing, someone under 18, but regardless of the age, making sure that, you know, your interview subject is in a location and in a context that they are comfortable. That might mean bringing in a parent or a friend or a social worker, someone who, you know, they are comfortable with. It might mean just, you know, it might also mean making sure that you protect their identity, because they might be in an ongoing situation in which they are either in danger or uncomfortable. And we need to make sure that in, you know, not just in the final story where we might change their name, and make sure, you know, as a visual storyteller, also make sure that you're not giving away in the photographs or in the video any identifying factors. So, you know, you might not have a picture of them, but if you put a picture of the front of their house, people in the community will know which house you're talking about, right? So making sure that no matter what you use for visuals, it does not, you know, it protects their identity, it protects them. But also as part of the interview process, making sure that the questions you ask are not putting them, you know, we, as audiences and as journalists, we don't need every nitty gritty detail. We don't need that, right? We can provide the context. And if you want to talk, I saw a question in the chat about domestic violence and protection and how do we report on the causes. We don't need to ask necessarily the person who is the survivor what caused this incident. That might be a question that we bring to experts, social workers, responders. A number of my fellow panelists mentioned, you know, really great NGOs or CSOs that work in these areas in each of their countries. So building that network of experts that you can ask about these issues is key for journalists to make sure, like, those are the people that you can ask about causes. You know, what are the causes in our society? What are the issues? What are some of the contextual information that our audience needs to know? So you can bring in those other voices without having to ask the survivors themselves.
I wanted to ask you before we move on to someone else, because you talked about photography being one of your favorite ways to capture. What about images? What has been your experience in images for this topic?
Yeah, I think, I mean, actually, I have a picture with me. So I think whenever I go about doing a news story, I think, you know, we all know a picture tells 1,000 words. A picture can draw people to a story. It can make us connect with the individuals in it. But of course, when we're talking about gender-based violence and domestic violence, we need to be so careful as photographers, and video is yet another extent, because if you don't have images for a video report, you don't have a story, right? So I know it's pressure on journalists to make sure that we can tell the story visually. I know one of my other fellow panelists mentioned, like, infographics. That can be a way also to try to visualize the context and the number of incidents or the data. That can be a great way to do it. But you can also try to take photos that do tell the story while still protecting the individual. So I'm going to give an example. This is a photo I took last year with UNICEF in Sierra Leone, and it was a case of a child marriage, and the girl in question was about 14, 15 years old, and she had been involved in child marriage, but then also she had been beaten by the fellow wives because it was a multi-marriage situation. And so I wanted to make sure that I took a photo to draw people into her story while protecting her. And so what I did is she is in her home, where she is now back with her grandmother. And so I wanted to show her in her context, but without identifying the home. So you can see here, I wouldn't be able to pick that home, even if I knew the community. It's just a mud wall, right? And a doorway. So making sure you frame them in a way that doesn't give away who they are, where they live. Also, you know, you can't see her face. It's a very popular hairstyle there. So no identifying features. I mean, the cat, it's photography. Eyes draw people into the story. So, you know, it's sometimes luck, but also just thinking of ways that could make people visually interested and read them and draw them into the story. It might be through photos. It might be through, through infographics, but making sure that regardless of what you do, again, it's do no harm. So make sure that the photos or the videos you use, and the individuals might be really uncomfortable. I normally do photos or ask to do photos after I've done the interview. It takes a little bit of the pressure off too. And I work with the subject to see what they would most be comfortable doing. If maybe it's a picture of hands, maybe it's a picture inside. This is another photo from the same girl with her and her grandmother, who is now now protecting her. And
very powerful picture.
Thank you. I mean, it's another example of a way you can be creative with your photos without actually while protecting the survivors or the subjects.
Thank you for sharing those, Arlen. Any of the panelists who wanted to comment on anything, feel free. For the attendees, once we get to the discussion period, you can raise your hand and we will allow you to speak. I see there is a question about being able to speak and turn on your video. That will be enabled in about 10 minutes when we go to the discussion segment. Thank you, Arlen, for that. That was very interesting. Anesta and Nicasia, you are both here in the Caribbean. It was alluded to earlier. This is not something that is talked about. Whether it be a woman, whether it be children who may be being abused. What is it like, whoever can go first, covering this in the Caribbean, where almost everything is very hush-hush, it's a secret. And how do you deal with it? Nicasia, you kind of already said it hits you here. We know what that means, you know, it's not easy. What is
Yes,
it like for you?
it goes to the core. When you go to scenes, unfortunately, I have to go to scenes where I have to report on the murder of a woman. And that really hurts a lot. One, you know, you have to be very careful about how you are reporting, how you're doing the interview with the person, with the family. Hearing the family speak, wow, it's hurting because the last story I did, it would have been just before I went off on maternity leave. That would have been uh, late August of 2019. This guy had murdered his wife. They have about 8 children together, and her youngest was about 1 year old. And it was so hard, you know, going to that scene and reporting on this issue, because to hear the children speak, you know, it's really hard. So reporting on domestic violence case, from my point of view, it's very touching. Sometimes, you know, some people don't even want to talk about it. You have to find ways and means of speaking to that person. As you said, it's taboo. People don't want to talk about it. And you know what? I spoke to a neighbor for that woman, and the neighbor was saying that she did not even know that this woman was going through such in her home, because the guy worked in the interior. We say interior here, it's the mining district, where they do gold mining, diamond mining. And so he was away most of the time, and he had accused her of having an affair. The neighbor said she did not know all of this was going on. And, you know, the woman would come over and they would talk normal. She hadn't the slightest idea that this was happening until the afternoon of the incident. She just heard screams, and then she found out that this was happening. So it is really, really, really hard doing this story. At first, when I started this journalism 12 years ago and having to do these stories, I would actually cry. I would actually cry when doing interviews. I've learned how to, you know, control myself when I go to these scenes, but it affects me sometimes. And, you know, when I come home, I have to really, really shut that out and deal with my family. I encourage women every day. I said, you don't stay. And because I've been covering domestic violence for so many years, that if I see the simplest of a guy hitting a woman and yet telling her, I love you, it angers me. And I tell them, I said, why are you staying? Just go. You know, you have so many persons out there that can help you, that can work with you. You just have to know who to talk to. Because of course, some people take advantage of persons who come to tell them something, and they take it and make it a laughing matter. So that is my 2 piece on.
I think it's hard to cover this without becoming an advocate of some kind. Ms. Hines here in Barbados is saying Anesta is becoming quite the advocate, and is very keen on covering topics like this. I must admit that I shied away from straight journalism because I'm a very emotional person, and I don't know how you guys do it. I'm glad that you are doing it because you have an important role to play. Anesta, tell us how you manage covering this very difficult topic, your self-care tips.
So let me first make it clear, I'm not at all an insensitive person. But being in the media from the time I'm 30 now, and I've been in media from the time I was like 15 years, still at school learning the job. Um, I have learned that, as Nakesia said, it would consume you if you don't learn how to put up barriers. You're not being you're not being insensitive, because to get that story, you still have to you still have to a certain extent feel the emotions of the victim, or the families or the neighbors, the persons who are hurting. But at the same time, you have to know that in order to do, it's like a doctor cannot, someone may come into the emergency room, bleeding a gunshot injury, but the doctor can't break down and, begin to cry and weep and mourn, oh, yet another person. The doctor, they have to be professional. So for me, it's about being professional. I cover, they call me the undertaker. No, I'm not, but I cover a lot of debt related incidents and stuff. So I have learned that, when I go home at night, I want to enjoy my sleep, but I also want to make a change. So I go to the scene. I do what I have to do to get my story, to get to research, to call the same behind other agencies, to get some statistics, to get someone to speak up, to bring more awareness to the issue. At the end of the night, when I go home, I want to enjoy my sleep, because the next day, I have to be strong again to be the people's mouthpiece. So it, I do not take it on as much as Nakesia would. I guess it boils down to you as an individual, you as your personality. And that's about it.
Okay, thank you for sharing, Vanessa. Formala from the Caribbean Development Bank, Ms. Formala Jacobs, you wanted to make an intervention here. Feel free to open your mic and you can go ahead. She's a gender specialist with the Caribbean Development Bank.
Sure. Thank you very much, Lisa, and all for this opportunity. Just following the dialogue, and I wanted just to share some experiences, especially from my previous work in this area, managing a one-stop center that provided services to survivors who experience gender-based violence. One of the things that I think, even within this discussion, that we need to take into account as well is that the journalists and staff and the team members from the media houses are part of the same communities who are either experiencing or exposed to violence within their own households and communities themselves. And I know that I have worked on the ground in many instances where persons who have been covering these stories and so forth have also reached out to me and to our center for services for themselves and persons who are close to them. So I think this is something that we also need to take into account. This is training and access to services and also support for persons who are covering these stories in a very real way, connecting them to services so that they can build that level of expertise, skills, empathy, and all the things that are required to cover these stories at the highest standards while maintaining and taking care of themselves. And understanding, and I think you said this as well, Lisa, that this is about being advocates as well, not just going after a story, but just also ensuring that it's about social change. Another point that I wanted to make is just the importance of how journalists and the media reflect or put stories out about actual service providers and the NGOs. That's very important. It's really extremely difficult to get survivors into the doors of these service providers in the first instance. And when we have unfortunate, irresponsible, or negative stories about these service providers in whatever way, it can impact the types of resources that are available and the confidence that these survivors might have in these service providers as well. So I think it's just important to understand, investigate, get research information about quality services and put those things out. And finally, just connecting. I know being in the media, a lot of people might reach out to you and might want to find out information. And it's very easy to kind of try to provide a kind of advocacy role, that kind of service provider, counseling type of role. But it's very important too to have a database of services that are available, and understanding the importance as media to connect people to these essential services as opposed to trying to offer them yourself. So thank you so much.
Thank you very much for that intervention. That's true. You know what? Journalists are people too. Journalists are going through their stresses at home. Journalists have children sometimes. Journalists have parents who, you know, so it's true. Thank you for raising that. That's very important. Isabella, I wanted to ask you about the story you mentioned, because it kind of brought together what we're talking about here in terms of context and using journalism as prevention. The story that you mentioned with the gym. Could you maybe tell us in a quick way, because time is running, how you approached that and what it felt like to be, because that was prevention. We hope that, you know, it was for some.
Yeah. The story was that the professor was abusing these girls for more than 2 decades. So I spoke with the women that were abused 10, 15, 20 years ago. I spoke with 6. Well, of course, in a prevention point of view, when we publish this, I don't know how to explain this, but when you publish something, obviously you have like some expectations about some things, because it was an investigation. It was all like cover up, and has happened for decades. And yeah, when it was published and the gym was closed, and he was he's not in jail or something, because justice here is really slow and there's a lot of issues, but only the fact that the space is closed and he's no longer abusing girls, you know, that's like a lot. And I may add that the survivors of this story, some of them were really empowered, like half of them, and the other ones at the beginning, they didn't want to talk. It took like 8 months, and they were like, I'm trying to talk about everything that we have spoken here, because obviously when a survivor, if she says, I don't want to talk, obviously I will respect and not like pressure, please. So I just like said, that's okay, I understand. And maybe, I don't know, 2 or 3 months later, I do like some follow-up and said, I'm still doing the story. I found this and this. And as you, there are other 3 or 4 women. And what we wish it could happen, I can't assure you, because I'm not a judge, I'm not a lawyer, I'm not a prosecutor, but we are trying to stop this man to continue the abuse. And that, I remember I get to that story. I found that story because of these NGOs that help women and are my reliable sources the whole time. So I think it's very important what Farmala just said, like having this relationships and networks with NGOs or these shelters, that we can jointly trying to make these changes, small changes after all, but trying to, because they, as the NGO, they were preparing a campaign, like a social campaign. It was called We Will Be the Last Ones, like to be abused. And it had happened before, like 3 years ago, that a group of survivors from another professor, dancing professor, they launched this campaign, but they did not have the support from media or a journalist. They just did it by themselves. And that never changed anything. You know, the man is still free and he's still teaching. And so it's how can you find the support from women, you know. And I say women because we're all women here, and I think it was Anesta or Nakasha who said, I think it was Nakasha, like, why are we telling these stories? Because we feel them in our body, you know. and I know NGOs and lawyers and psychologists and activists, we're all trying to get like in the same path, from our different, we said in Spanish, like trenches, you know. So I think it's one of the objectives of the goals of this beat, or trying to report these stories, are especially what you said, the prevention part of it.
Thank you, Isabella. So what I'm going to do now is I'm going to ask Britta to come back in. And I also want to hear, Arwen, from you, because I just love the theme of Internews, where you say information saves lives. And that's just, I mean, period. That just makes so much sense. And what I'm sensing here is that journalists need experts to work with us to share the information. One of the questions, a lot of people did say they don't feel technically equipped sometimes to report on this issue. So we want to give you the resources. We want to create and Arwen, you can talk about this, perhaps a group for persons who would like to be a part of a group of people who cover this very difficult topic and learn tips and learn from each other and support each other. So Arwen, if you could maybe tell us a little bit about that side of it and Internews.
Absolutely. So yes, I mean, at Internews, one of our main themes is also really focusing on solutions journalism. Like, how can journalism make a difference for the communities that it serves? So as a journalist, you're an information provider. You play a really crucial role, and you have a responsibility in order to provide information to your audiences, to your communities, that they can use to make important decisions that affect their lives. And on the topic of domestic violence, that can be about providing information for service providers that people can access, for information from experts about how to protect yourself if you find yourself in a situation where you are at risk, or you are experiencing violence. What can you do? And even also demystifying the process of something like, if you do reach out to one of these providers, what happens? How do they protect you? Are you going to be at risk because you've reached out to them? And actually providing those kinds of step-by-step information can be a really good source of aid. I mean, information as aid, right? This is information that people can use to hopefully improve their lives or protect themselves or their loved ones. So one of the things we wanted to do as kind of a offshoot of this discussion today is at Internews, we want to provide to start up a WhatsApp group. If any of you listening might be interested in joining, we will include the link in the chat, as well as in follow-up information that will be sent to you by the organizers for how you can join. But is be a space where we can share best practices, where we can ask questions of one another if you want, support or advice on covering certain topics, where you can share stories that you're working on, and basically have it as a sort of solidarity group for us to work together. We all, as journalists, a number of my fellow panelists have talked about how this can take a toll on you as a journalist. So this is one tool that we would like to offer and encourage you all, if people are interested in covering these issues, to join, so that we can continue the conversation in the days and weeks and months to come.
Thank you, Arwen. Britta, is there anything you'd like to say before we go into some of the questions that we already have posted and more coming in all the time?
No, just it's a really interesting discussion. I'm interested to hear what people, the questions. I do want to stress, I think, yes, this is a challenging topic, but I think the impact that journalists and communicators make is unbelievably important, unbelievably powerful. And I hope if there's one message you come away with at the end of this, and we're not yet at the end, is how very important that work is. Yes, it's tough. I don't want to minimize that, but it is so unbelievably valuable, because it does change. There is the opportunity to educate, to change public opinion, to change social norms, and that is what we need to prevent violence. And yes, data is not perfect on this topic, and it's quite complex. So sometimes it is difficult to work with it. But there's actually much more information out there than we think. It's not perfect, but there is often information we can draw on, and there are resources by different organizations that PAHO has, that different UN partners has, that Internews has, that we can draw on as a sort of broader community, and we will mention this again. And the other thing I want to just mention, and it sort of relates to a bit to one of the comments I think that was in this chat. Yes, sometimes a survivor might choose to stay in an abusive relationship, and I think our job is not to take that decision away from them. The survivor know the best what they need. And I think our job, in no matter what role we are, whether we are a health service, a protection service, a journalist, or an advocate, or a civil society actor, is to support the survivor in their choices and to make them aware about their choices and about their options. And that's where journalism comes in. There you have this like channel to communities, to survivors, to make them aware of their choices, to make them aware of needed information, and to make very clear to them that help is available, that it is not acceptable behavior, that everybody deserves to feel safe in their home. Because the number one barrier that people don't seek help is because they think it is not needed. They think violence is normal. They don't see it even as violence. They don't associate it with the word. And we can only change that by communicating the opposite. And when journalists, when communicators, when different actors in society do this, and we give voice to the different voices that makes a difference. But very happy to hear the comments. Thanks.
Sure. Thank you. I'll start with Jessica Harris's comment. She says it's important to establish a protocol for covering gender-based violence cases. Is that what we're saying? Could there even be a protocol, or are there just tips that persons can follow? And her point is that we need to not re-victimize the survivor and justify sexist violence, which then generates empathy sometimes for the perpetrator. Britta, I'll let you start, and then anyone else can jump in on that.
Yes, I mean, I so agree with the second point. I think there is, in any communication, a risk of justifying violence, of helping the other side, right? Like of trying to explain why violence happens, trying to make it specific to a certain cause or certain, that would explain why this one incident happens, but it's not something that affects society as a whole. And that's exactly, I think, where accurate journalism, responsible journalism comes in, to frame it in that human rights and gender equality framework, to look at context and all of the tips that have been made. I think on the issue with protocol, it depends. I certainly think that's an option to both as a media organization, but also at the national level, but it could also be tips. I think the point is that this is an important topic, and that we as a community, including everybody on this call, can help each other make their own stories reach more people and do more good in whatever way that is possible, whether it's a protocol, tips, networks, WhatsApp groups, and whatever is needed really to help each other prevent violence from happening.
I would like to add that I think it will be more tips and as Britta said, networking more so than protocols, because every is different. Every story is different, so it's going to be very hard. Even if a news organization may establish their own protocols, it's going to be hard as you walk into a different story each time, especially with these type of scenarios. So establishing a protocol to me is going to be more like common sense, and also remembering as a journalist that while bringing stories about domestic violence to light, journalists must ensure that they remain within their boundaries. You be an advocate, you share the information about, solutions and relevant agencies and stuff that are available and are waiting to respond, but you maintain your boundary. I think that should be at the head of the tips list, not just about the protocols.
Okay. Anyone else wanting to comment on that before we move on?
Yeah, I would like to add, when I think about, when I hear the word protocols in this context, I also think about, newsroom guidelines. And as Anessa said, it's different for every story, for sure. But it's also maybe worth, if you are covering these issues, having a discussion with your newsroom, especially with editors involved, about what is your outlet? How is your outlet going to treat specific cases? And that includes things like naming survivors, naming the accused if they have not stood trial yet. This is going to be different by country to country, but also it can be different by newsroom to newsroom. People do have the right to a trial, and we do also have to remember that, having your name, whether you are a survivor or a friend or a mother or, someone involved in the story in any sense, it could lead to stigmatization. And so we have to be having these conversations with our newsrooms so that we all are kind of on the same page. And it might change story to story basis, but any of us who worked with editors before as a journalist, we know also sometimes what we write is not necessarily the final product that is printed or broadcast. So having these conversations about whether you want to call it protocol, or if you want to call it style guides or code of ethics for the newsrooms, having these conversations is really important, especially if you're covering these beats. And that's something, that you can draw from examples from other newsrooms around the world, but you can also start to have this discussion in your own newsroom.
Thank you, Arwen. There's a question directly for you. We often report on the different domestic violence and protection issues. How do we report on the causes, whether mental or psychological, that are contributing factors? I guess responsibly. How do we report on the cause, or do you say the cause?
I want to add something very short on that, if I can, because I read that question before, and we have already talked about the causes and how dangerous can it be to focus on the causes, like justifications, like this is why he killed her. And I think Arwen said specifically, when you need to talk to the experts rather than the survivors or the family, but the specific question about the psychological and mental context, I think it's also dangerous because it eliminates the cultural and social problem, which is sexism, and patriarchy, and we can all understand. It's not. I remember once I interviewed an anthropologist that is specialist in gender, and she told me there have been many times in which murderers, like men that have murdered their women, they say they have mental problems or psychological problems, and that's the excuse. So I'll be very, very careful on that. I'm not saying that they might have, but it's, again, the context is so important, and not focusing on, oh, but he was bipolar. So it's really delicate issue to talk about the causes, as Arwen explained perfectly, but saying that mental and psychological can be an argument, a single argument, that's just an excuse to erase the whole cultural and violent context that we live in.
Arwen, did you want to comment or anything on that one? Or did Isabella cover it pretty well?
I think Isabella covered it very well.
Rita wanted to say something as well.
No, it is just that from a technical perspective, we don't talk about the cause. There is no single cause. So the moment you read this in a newspaper article, you know it is not accurate. There is no single cause of violence. There are multiple causes. There are multiple risk and protective factors. So when we talk about writing about understanding context, it is useful as part of context to talk about multiple risk and protective factors that might be happening, including at different levels, the individual level, the relationship level, the societal level, the community level, right? So it is never a single cause. It is multiple different factors come together. This is why it is so difficult also to prevent it, because as a result of multiple causes, it also means there's no single solution. There are many different solutions. But the good thing of that is that we can all help to find solutions, right? There are multiple different solutions. One aspect of the solution is to give more visibility to the topic, to talk about it. But it is really important to not make it about a single cause, because that is a misrepresentation of the evidence.
Okay, thank you. There are two comments here that I think I can link. Basically, it's asking, there's Daniel Epstein, and then we also have Jermaine Abel from St. Kitts. And Daniel is asking if the critical path for women to report abuse and get help, if that's still important in Caribbean countries. Are we pushing that as the critical story? Are we making that important? And then Jermaine from St. Kitts is saying, there's a lot of talk surrounding COVID-19 and domestic violence. How important is the end story, or how important is the top story? So, you know, the lead up, the causes, the support, than the end story, which sometimes is sadly where Anesta often has to come in to report on when things go wrong. Shelter and care. Is that critical path for telling that story still important here in the Caribbean or in the context where you are? Are we seeing that? Anyone can answer that one. Are we seeing that type of coverage, or are we mainly seeing when something goes wrong and someone unfortunately loses their life?
For me personally, I will have to, from my observation, and I mean it's good, but I think that's where we are right now. I don't think it's something we want to admit as journalists, but I think that's where we are right now, where we see a lot of the crying and the newspapers and you see the, you know, the relatives on the front page or the back pages, but yeah, we definitely need to do, I like to call it awareness stories. Yeah.
I mean, I suppose it's the elephant in the room.
Yeah, that's
are those stories, we know the stories that people want to see, that sells papers, and we know what we're being called to do, but we know what some editors want and what we think the public wants. I say we think. We don't know that that's what people want to see on their front page. I certainly don't. Anyone can comment.
But may I add to that, as you mentioned about what people want to see, if you look from my observations, when you do those type of stories, I like to call them the end result. So when you do those end result stories and you look at the newspaper will be published the story on Facebook or Instagram or Twitter, and you look at the response from your readers and your viewers and the conversation. So there's a lot more conversation, but then you may write a story. The same now may invite you to an event and they may speak about women speaking out about domestic violence issues before it's too late. But you don't see that same level of response. So then you have to ask yourself, what is it that society wants? You know, it is not just about the news agency, but look at the response from the society, from the public.
Agreed. Someone else wanted to add? No? Okay, there's a Q&A in the chat box. SRHR is an organization. It's about to expand the gender-based violence service. We're hiring a counselor who will do face-to-face and telecounseling and referral. How could we engage with the journalistic community? What might be the best role for journalists in such a new prevention, care, and counseling support and referral program? Pauline Russell Brown. I don't know if this is understood, but is there any way that you journalists think that a journalist could assist a CSO working in this area?
I mean, I can give a suggestion in that I mean, this sounds like a really wonderful initiative. And again, it goes back to what I was talking about, solutions journalism. I mean, making sure that journalists understand that this is available, how it works, and being able to provide a story. You know, sometimes it might be up to you as a CSO or an organization to try to build your networks with journalists too, and say, this is available. We would love to invite you to talk to us about this. We would love to be able to share information. And as journalists also, when you're covering this type of initiative or option or solution that's out there, to really make sure that you understand what people might need or want to know in order to access it. So maybe that might be asking someone, or maybe it might be just thinking about, if I were someone who needed this service, what would I want to know? I would want to know, is it free? I would want to know, when could I access it? How could I access it? Is it secure? Is this going to put me at risk? What is being done with the information I provide? In talking to them, will that lead to it being reported to the police? Maybe I'm not ready for that step. Maybe I don't want it to go to that step. So really understanding and breaking down as a journalist how this works, but then also, you know, as the CSO, maybe developing a fact sheet about it, answering some of these questions and sharing it with local media to try to get that attention. But I think that having that relationship with journalists is an excellent step for creating awareness about this type of service.
Agreed. Anyone want to add? No? Okay, we can continue. So we know and we have heard that it seems as though we do have an increase in domestic violence during this period as it relates to COVID-19. Someone is asking if there are any statistics as yet to give an understanding of how COVID-19 has impacted on mental health. Berta, I don't know if you can comment on this, or even Elisa.
Yes and no. And I don't know whether the question was on mental health in general or mental health of survivors of violence, which is a slight difference. And I think, and this comes back to my earlier point, we do have data. It is not perfect, but we do have some data. And I think the challenge, I would assume, when you're developing a story, is to find out the data that you can use to give some precision to your story, to explain some of the context. And I think it's something that Isabella mentioned earlier. But at the same time, also recognizing where gaps are, and there are gaps on data. So we do have data, good data, that link, for example, violence, the experience of violence, with the mental health consequences before the pandemic. And that is data you can use in that context to talk about these two things. You have good prevalence data that shows the burden of violence on a certain population and the mental health impacts and the increased mental health needs. You might, in a given context, also have additional data in the context of the pandemic on mental health helplines and how calls to mental health helplines have increased. Now, that is not prevalence data, you can't present it as such, but you can use it as a way to build your story, to talk about the potential increase in risk, in potential increase in need. If you have increasing calls to mental health helplines, it may suggest that there's an increased need or increased mental health impact, particularly for survivors. So you draw on different pieces of data to build your story. It is not perfect, but I think there is enough to make a very strong argument for the need to pay attention to domestic violence in the context of COVID-19.
Thank you. And Ms. Hines does say that data collection is a major problem in many areas here in the Caribbean, for sure, in terms of finding, and I guess it's like you said, Britta, where there's no one place to go for the data. You kind of have to pull from different sources and use that to frame your story. But
yeah, and I think this is where you come in, like with working with different partners, right? And I thought the question that we just discussed was really good, because as Arvind said, it's sort of like a two-sided thing, right? Like me, I'm more on the technical side. My job is to engage with journalists and communicators to make sure what I have as technical information is in a format and it's available and it's accessible to journalists, communicators in a way that they can use. And likewise, like journalists have a role to engage with people like me, people like civil society advocates, like service providers, like different types of like organizations that have information on the topic, to use it, to answer the questions that they need. So it's that, right? Like it comes back to the engagement across different disciplines.
We're getting close to the end of the comments, so if you have any questions or comments, now's the time to put them in because we are quickly running out of time. A question here on domestic violence happening behind closed doors. Neither victim nor perpetrator want their neighborhood or the public to know what's happening. How can we help these persons while maintaining their privacy? As a journalist, how do you maintain privacy but cover the story? Anyone can answer this one. Yes, Isabella.
I can give a short answer to let the other panelists, but the word private, it's really problematic for domestic violence. It's actually the word used by many politicians or people that don't know what to do with the gender violence problem. So there's no way you are violating privacy when you call 911 if you hear a scream next door. So it's like gender violence is a public problem, even though it happens indoors. Like that's what I have to say about it.
So we need to reframe the conversation to not even include the word privacy. It's not private. I hear you. Nicasia and Anesta here in the Caribbean, we know it's private. And how do we change that? Through the human rights discussion, Arwen? How do we change that?
So here in Guyana, we know that domestic violence continues to be a stigma. Here in Guyana, training has been emphasized through the courts and the judicial system. They have been involved in a lot of training in terms of dealing with domestic violence. What you courses
you're sticking a bit.
Or
okay, we can hear you.
Am I okay now?
Yes.
Okay. Wait, see. Should I start over?
I think so because I kind of missed what you said.
So okay. So what I was saying is that we have started focus on training for the Guyana Police Force and the judicial system in terms of dealing with domestic violence issue. It is customary, or it was customary. I think we have been having some changes, which is good, in terms of how they deal with, we say DV matters, the DV, domestic violence matters. If somebody comes to the station, you don't turn them away, but you take the report. I know that in the past, people found it funny. They would, they would laugh, but even if a male came to make a report, or a female, they would laugh and say, you should go back home with the person because, when y'all make up, everything will be okay. Well, they don't do that anymore. They take the matter, they're instructed to take the matter, and it must go to court. Once that matter is reported, it must go to court. And they do not allow the victim to have to relive that report or the incident every time. So what they do in the judicial system now is that they do recordings. So they do one recording, and they use that if they have to continue investigations, they would relook at the tape, they would review the tapes. So that's how they're dealing with domestic violence matters, which I believe is good. So, encourage persons to come forward to the police and to talk more, so they're not being turned away.
For me, the word private, I agree with Isabella. That's a bit. I don't know how to explain it. That's a bit touchy when it comes to journalism. There's no There's no privacy. The journalist's responsibility, and that's where we go back to the conversation we had earlier about the source of the story. We still have to remember the who, what, where, when, why, and how, which comes into play when we're reporting, when we're putting together, structuring our story. So privacy, yes, well, you agree that something happening in someone's home is private, but it's no longer private when someone dies. You still report the story. So why is it private? I don't know. That's so. I don't know if it Britta can explain it, but that one has always puzzled me.
Britta, you can take it from here because Anesta is clearly struggling with this one.
I have a couple of points. The first one, and it's sort of, I think, what Isabella has said. The issue of framing as private is sometimes very problematic because it's used as an excuse. And we overcome that by making it visible, by reporting on it. So that's the first step, to make it a societal issue and not make it a private domestic issue. And we do that in a way that is that highlights solutions, right? And as I mentioned earlier, when it comes to solutions, when it comes to identification, it might be really different. Yes, there might be a law enforcement, police aspect to it as a source of help, but it might not be what the survivor wants, or it might not be what is the best solution in that given moment. The point is that there are many different solutions. I work a lot with the health ministries and the health sector and health services. And some of the data from Caribbean countries that we see is that health workers, including nurses, including doctors, are often the first point of contact for a survivor, because it is a more confidential, private space, and it's somebody they trust the most. And that gives them a space to talk about the experience of violence, to get help, to get support, without necessarily going to the police, making it into a legal thing, right? Like, it is up to the survivor to decide what would help them the most. They will know the best what their needs are. Our job is to make sure they know they have the information they need to make these choices, to be aware of the options. So I think when we talk about solutions, it's about thinking also about the multiple different solutions and sectors and actors that are involved. And lastly, I think, and that links back to the privacy issue again, it's really important when we report, it is an opportunity to take away a bit of the privacy and the stigma of it, but we need to do it in a responsible and ethical way. So making it less private or less stigmatized does not mean identifying the survivor, right? That is a big red flag. When we identify a survivor of violence, it means normally the violence escalates. It means that stigma becomes worse. And this is exactly what Ava meant when she said, do no harm. At a minimum, we need to make sure that we don't make the situation worse by our reporting. So we don't identify the survivor. We don't normally mention their full name. We don't add a photo of them or their family or their house and various other things, right? We take steps to avoid this. For example, by, as you saw in the image, by showing them from the back, by not showing their face, by showing it in a way that could be multiple people, by changing their name. One of the typical things I see when it's about a human interest story that is an interview of a survivor in a news story, in a written news story, is that their name has been changed, and there's a little note that says your name has been changed for protection purposes, for privacy purposes, and that is well accepted in reporting on violence. I know it's a little bit strange from a sort of because it's different to other methods of journalism. And maybe there's a need to engage with your editor and newsroom to make sure they're aware that when it comes to violence, reporting is really important, but there are some minimum standards we have to meet. And I think that comes back to the protocol discussion we had earlier. It's about making sure that all of our colleagues know that there are some basic things like avoiding identification that we don't want, because it will not have the impact we want. Because at the end of the day, I strongly believe that every journalist, every communicator wants to make the world better. our reason to engage on it is not to make violence worse. And when you identify, it creates additional risk.
Cassia, you want to say something?
Yeah, but to add to what Britta said, she said, you know, the first point of contact the domestic violence victim might have is the doctor or the nurse. But then that becomes, well, I mean, it moves from privacy between, you know, patient, doctor, privacy to the police, because here, what we have to do now is if a domestic violence case goes to the hospital and the nurses or doctors find out that the injury stemmed from abuse, automatically it goes to the police. It is reported to the police. It is not hidden. That's what we do here. So privacy becomes public then, because from the police it goes to court. But of course we in court, because I also cover court, we do not necessarily report on domestic violence cases in terms of the in-depth report or the in-depth matter that is being read out to the person, to the perpetrator. We just say that this person went to court. We do not name the person until they are maybe sentenced or fined, whatever. So we just said this person went to court for this matter, when and whence. We do not name the victim, and we try our best not to name the perpetrator, because of course you will attach it to the victim. So that's how we deal with those cases. We try our best as reporters here covering the judicial system not to report on domestic violence cases.
Okay, thank you. I'm going to give pretty much the last word to Britta, and it's maybe to also talk about images, how we use images, and any last tips that you'd like to give. I am definitely also seeing that people in the chat are interested in joining that WhatsApp group. So maybe that's something that we can put back in there so that they can see that, because this is a conversation that probably needs to continue. Yes.
Yeah, I mean, thank you. I think this has been really interesting, and I think part of the value of this kind of event and what is highlighted again to me is that the value of having these sort of communications, having these kind of interactions, because there's a lot we can all learn from each other, and I think that's the point also with the WhatsApp group, and with future steps we will be in touch by email to share some additional resources. As I mentioned earlier, there's a lot of information on violence on, for example, the PAHO website. There's some information on the Internews website. There is a really useful handbook by UNESCO, which is exactly on reporting on violence against women and girls, that I will send to all of you, that has helped me a lot in thinking about the topic. And there's a lot of other information out there by UN partners, by civil society organizations, by governments, and a range of different actors. So I think this is not the end of the conversation, but it was really, the point was to get you thinking and to make you aware of the resources that are, and really encourage you to reach out to experts, to partners, and to continue this conversation for a specific story if you have a question, but also in general if you want to engage further on this topic. Because I think that is part, I know the majority said they don't feel technically equipped, but we can change that. We can help each other to become technically equipped. So the offer is there, or to everybody who's on the call and others that you know about, that because we do really value the engagement of journalists and communicators on this topic. And we've put together some like do's and don'ts that highlight some of the messages, from the do no harm, to using language data carefully, to providing information about support services and helplines, to other things. So we will send that out, and it comes with the presentation. And any further questions, please do contact me or any one of my colleagues. Thanks.
Thank you, Britta. We are definitely out of time. I think it was a very worthwhile discussion. I think it was an introductory discussion. I feel like this discussion needs to continue. Dr. Prieto, more work for us, but I think it's important work to do. I want to thank everyone for joining today. I don't know if Dr. Prieto would like to say anything as we wrap up. Feel free to turn on if you want.
Sure, thanks, Lisa. No, just to say again, thank you to all the panelists for your excellent contributions.
You can turn on your video as well.
Am I breaking up?
No, but we can't see you.
Oh, sure. Yeah, so I just want to say again, thank you for the excellent contributions. I think it was a really very interesting conversation. I love the fact that you were really sharing from your own experiences, and I think it was a very nice mix of contributions. Thank you also to participants. We had 52 attendees, and I think that's great. We are very happy to see that level of participation on this very specific discussion. Thank you also for your contributions in the chat, the Q&A. I think we managed to cover most of the questions, but we'll review. And if there's any outstanding question, we'll make sure we address them. Thanks to Internews for your kind offer to set up that WhatsApp group. I think based on what we've heard, that is going to be a wonderful resource. This is an ongoing discussion. We all have a lot to learn. And I think this is relevant, not just, maybe that's what I would like to emphasize. As Britta has said over and over, this is a very complex problem. There are many different solutions and we all have a role to play. And you know, we are all communicators in one way or the other. For us, working in international organizations, for colleagues working in ministries of health, in government information services, it's not just about reporting and creating stories, but also, you know, when we organize an event, how do we create the flyer for that event? What type of images do we pick? How do we, title our activities or communicate about our programs? So there's really communications in what many of us do, not necessarily as journalists, but somehow as communicators in different roles and from different perspectives. So I think it's a great learning opportunity for everybody. I take your point, Lisa, maybe we need to have a follow-up conversation to go more in depth in some of the pieces that we touched on today. And thank you also for CDB for joining us in this initiative to strengthen this partnership and collaboration with journalists and communicators. Thanks for being with us. Thank you, Farmala and Jessica, for your contributions and perspectives. And thank you, Lisa, for the great job you've done moderating. You are the master. Thanks for that.
Yeah. Thank you, Dr. Prieto. No problem. I love to talk to interesting people, so this is a joy for me. I want to thank you all so much for joining us today. We are going to post this on our PAHO TV YouTube link website, and also on the PAHO Caribbean page. And if you would like a copy, as I know some people have already asked for a copy of this recording, we will send that to you as well. So all that is left for me now to say is thank you. Continue to enjoy the rest of your day, and I hope we can continue this conversation in some way soon. Thanks so much and have a great day. Bye-bye.
Bye.
Bye. Bye. Thank you.
Bye. Thank
you, everyone.
Thank you. Yes.
Thank you. Bye.